Public Library, and all of you for having me speak with you today. My name is Dr. Marc Rubestein from Jersey LiveWell and Jersey Physical Therapy. I'm a proud member of the Academy of Prevention and Health Promotion Therapies. Every disease that is killing us in developed nations has causal and significant links to lack of sleep. This was from Matthew Walker, who is a sleep researcher at UCal Berkeley. So in the first two lectures of the Jersey LiveWell series, we spoke about the importance, the right amount of move and proper fuel, and how they're vital to the prevention of chronic disease and the promotion of optimal health. Today, I hope to make the case that sleep is just as important to good health as exercise and nutrition. My goals for today are to provide some information on the importance of sleep. Number two, to give you some tools to improve sleep health. And number three, last but not least, I hope not to put you to sleep. Okay, so does this look like anybody in the picture here? This pretty much sums up how important sleep is. With sleep, there is vitality and health. Without sleep, there is low energy and disease. Sleep loss and sleep disorders are the most common, yet frequently overlooked and readily treatable health disorders. So here are some sleep statistics. Sleep disturbances occur in 1 out of 3 Americans. It's estimated that 50 to 70 million Americans chronically suffer from a disorder of sleep and wakefulness, which hinders our physical function and adversely affects our health and longevity. 70% of high school students get less than 8 hours sleep. 15 million children do not get enough sleep. And probably the most troubling statistic of all is that 90% of sleep issues are undiagnosed and untreated. The CDC has termed lack of sleep a public health problem because lack of sleep is associated with a higher risk of chronic disease such as diabetes, stroke, and cardiovascular disease. So the question is, why are we so sleep deprived? And there's many reasons. Number one is electrified light. We have light in our homes. We have light in our schools. We have light in our work. We are on our cell phones, which has blue light, on our iPads before we go to sleep. So electrified light is a degrader of sleep. Number two, we work more than ever and make sleep less of a priority. We almost wear lack of sleep as a badge of courage. I pulled an all-nighter. I'm working so hard, I just don't have time for sleep. That's a reason why we're so sleep deprived. Anxiety. Now, we all have nights where we're anxious and we have difficulty sleeping, and that's normal. But increased loneliness and depression is evident in our society. And finally, alcohol and caffeine. Alcohol and caffeine are more readily available than ever, and all of these things I discussed, they're enemies to good sleep. So why do we need to sleep better? And I apologize if you can't see this slide well, but number one, sleep improves our memory. It restores our hippocampus, which is involved in memory. Number two, sleep improves our heart. Sleep reduces cholesterol and triglycerides, and lack of sleep causes calcium to build up in our arteries and can lead to heart disease. Number three, sleep decreases depression. When we get sleep, we release serotonin and melatonin. And serotonin and melatonin reduce our stress hormones, adrenaline and cortisol. Ideal sleep balances our hormones, makes our body happier and emotionally stronger. Next, sleep increases creativity. Sleep supports weight loss, and we'll talk about this and the hormones involved later. And finally, sleep helps keep us healthy. It boosts our immune system and helps with sickness and disease. So I thought a really important aspect of sleep health is to discuss brain health and how sleep promotes that. So when we sleep, it clears out toxins in our brain, which have been implicated in Alzheimer's disease, these amyloid plaques. Sleep boosts mental health. It improves our focus, improves our mood and decision making, and finally strengthens our memories and promotes creative thinking. People who get less REM sleep or our deep sleep, our dream stage sleep, are at a higher risk for developing dementia. And we're going to go on next and talk about that 7-8 hours of sleep is essential for brain health and function in the elderly. So what is proper sleep dosage? And it changes as we age. And this is not definitive. However, there are recommendations from the National Sleep Association. So you can see, as a newborn, we all know that babies need lots of sleep, 14 to 17 hours. Sometimes they get more, and sometimes they get less. And as we age, we require less sleep. However, as you see here, school age and teen, we talk about 9 to 11 hours, and then down to 8 to 10 hours in the teenage years. Now, I, for one, know my kids sometimes do not get those recommended numbers. And that's okay. We're always going to have nights that we don't get sleep, but we're encouraging people to make sleep more of a priority. Young adults and adults, 7 to 9 hours. And finally, older adults, it's a little less at 7 to 8 hours. Now, as you can see, the light blue shows may be appropriate. So those are the recommended dosages I spoke of. However, a little above and a little below may be appropriate. Now, all the area in yellow, just not great. So if you find yourself there, you talk to a healthcare professional about improving your health and your sleep. Sorry. So what are the effects of sleep deprivation on our body? We're going to talk about both short-term and long-term. Short-term, lack of sleep affects fatigue. We're in a bad mood, lack of focus. Everybody can relate to this, right? This is normal. Daytime sleepiness, reduced alertness, and slow reaction time. What happens, we've seen with short-term sleep deprivation, is occupational and medical errors, workplace injuries, and impaired driving in motor vehicle accidents. One study I read said that when you get less than 5 hours of sleep, or 5 hours of sleep or less, your risk of getting in a car accident is 4.5 times. And when that's less than 4 hours, it goes up to almost 12 times. That's pretty staggering, wouldn't you say? Long-term effects of sleep deprivation. Increased chronic disease, such as diabetes, heart disease, and hypertension. And another long-term effect is simply shorter life expectancy. Over 20 long-term epidemiological studies confirm the link that shorter sleep results in shorter life. So again, it tells us that we really need to make sleep a priority. So next we're going to talk about a few other categories in lack of sleep. Obesity and lack of sleep. Lack of sleep is a risk factor for obesity, along with lack of exercise and overeating. Again, we just don't hear more about this. There is a link between insufficient sleep and weight gain. During sleep, our body secretes hormones that help control our appetite. There is lower levels of the hormone leptin. Leptin alerts our brain that we've had enough food. Doesn't that make sense? And it's also associated with higher levels of ghrelin. I hope I said that right. It sounds like gremlin. But it's ghrelin, which is an appetite stimulant. So again, lower levels of leptin, higher levels of ghrelin. Let's talk about the relationship to diabetes. There is less insulin released into our body after we eat when we get insufficient sleep. The body secretes more stress hormones. Remember, we spoke about the adrenaline and the cortisol. It helps keeps us awake, and it's harder for insulin to do its job. So the net effect is too much glucose in our bloodstream, which increases the risk of type 2 diabetes. And what we've read about is that less than 5 hours of sleep puts us at increased risk for type 2 diabetes. A little bit about sleep and heart disease. Lack of sleep, shorter sleep duration of 5 to 6 hours, has been shown to increase the risk for cardiovascular disease. And a single night of poor sleep can elevate blood pressure the following day. So there's a correlation between poor sleep and cardiovascular disease and stroke. There is also a link between obstructive sleep apnea and heart disease. And we're going to talk about sleep apnea in just a moment. So it's important, there's many sleep disorders. I'm just covering the two major ones today. One of the two is sleep apnea, one of the two most common. 25 million Americans, like I said, I'm one of them, have sleep apnea. And the signs, like we talked about in the screening tool, snoring loudly, apneic events where we stop breathing, and fatigue during the day. Now again, the effects are pretty significant here. We're talking hypertension, stroke, heart attacks, diabetes, and performance issues at work or home, wherever it may be. So that's why it's important that we identify those with sleep apnea and we treat them. The gold standard treatment, like I said, is CPAP, which is continuous positive airway pressure. You wear a mask or a nasal cannula at night, and that improves your oxygen and reduces these apnea events. Also, you're supposed to avoid lying on your back because that obstructs the airway. So again, if you're concerned about sleep apnea, talk to your doctor or healthcare professional. I can't say this any more clearly. Next, and again, another very, very common, probably the most common sleep disorder is insomnia. 65 million Americans, more women than those over the age of 65. Symptoms include difficulty falling asleep, difficulty maintaining sleep, and waking up too early, 3 nights per week, or 3 months. So again, the occasional bad night's sleep, it happens. But if it happens more regularly, that's when we have to look into this further. And what are the causes of insomnia? There are medical causes, such as arthritis, low back pain. There's neurological causes like Parkinson's disease, allergies. There's a whole list of things that lead to insomnia. Those are medical. Psychiatric causes would include depression and anxiety. And again, it's normal to be anxious every so often, but when it's persistent, that's something we need to talk to our healthcare professionals about. And finally, working too late, napping regularly. These could contribute to insomnia. So what are the treatments of insomnia? They're non-medical, and they include relaxation treatment, which we're going to actually do later. And I hope you guys enjoy that part. Stimulus control, which is basically saying that when we're in our bed, we associate sleep with our bed. So if we stay in our bed when we're not falling asleep, our body associates being awake with being in bed. So what's recommended, get out of bed, maybe a dim lit room, try to relax, whatever that may be for you, and then go back to bed. And cognitive behavioral training, where we try to change our thoughts, which can help us change our behaviors. And that's done by a licensed psychologist. So again, these are all non-medical treatments. There's also medicines, which isn't going to be covered today. But talk to your doctor about side effects of these medicines and whether they are appropriate for you. So as a physical therapist, I've been really interested to read about how sleep relates to pain. Sleep quality and pain perception have a reciprocal relationship. Sleep disturbances increases our sensitivity to pain. But also, high pain intensity leads to less overall sleep time, delayed sleep onset, and increased number of wake times. Pain is associated with poor sleep quality and shorter sleep time in those with chronic pain, low back pain, fibromyalgia, arthritis, and neuropathy. So why is this relationship between sleep and pain important? Well, relief of pain, which we've always thought of regularly, can help improve our sleep. So a lot of times when we have pain, we're going to seek treatments to reduce our pain. And again, that's one great way to improve sleep. However, what I'm reading more about is that interventions to improve sleep can impact pain. So I find this really interesting. Not only are we treating pain by our traditional therapies, but we're also treating sleep. So who here likes to participate in any form of exercise or athletics to any degree? So what I hope you find interesting is how sleep relates to sports performance. And I love this diagram. What it talks about here is that sleep helps with weight control. It helps with reaction time. Now, I've read that a single night of poor sleep can slow our reaction time by 300%. Now tell me, do you want to be almost intoxicated when you're playing athletics or exercising? Doesn't seem like a good idea, right? Stamina, decision-making is improved when we get sleep. Our motivation, our overall attitude is improved. And our accuracy. So for many sports like tennis, we need to have accuracy. And that's what it discusses here. Finally, sleep helps our body recover from a tough workout. It repairs damaged muscles, replenishes our nutrients, and reduces injury rates. That is so important. Sleep is an active period of recovery. And we'll talk about this again later. So now we talked about common sleep disorders. We talked about the statistics. We talked about brain health. We talked about the benefits of good sleep. We're going to talk about some tools that promote sleep health. And these are things you would tell your kids. It's not rocket science. However, you'd be surprised how many we don't follow. When I read this, that's what I said. You know what? I need to work in this area. So if you can learn one or two tools, then I hope it's helpful for you. Number one, you need to keep to a normal sleep-wake schedule. I know as a parent, who works, my schedule can vary depending on if I'm working late or if I have to take the kids somewhere, help my wife out, whatever it may be. So keeping that normal sleep-wake schedule as best as possible is a great way to promote sleep health. Next, use your bed just for sleep and sex. Put away your phones. We'll talk about why you should in just a minute. But again, your bed should just be, you should associate sleep with your bed. Have a relaxing bedtime routine. And we'll talk at the end. I'd like to hear from you. Are there any relaxing routines that you use? Because maybe we can learn from each other. I'm sure we can. And avoiding vigorous exercise 2 to 3 hours before bed. One of my patients told me last week that he plays basketball until 10 or 11 o'clock at night, and he has trouble sleeping. So this really it really hit home for me, and I talked to him about that. We have some more recommended. So let's talk a little bit about, since we talked about vigorous exercise, a little bit about how sleep and exercise are related. Most of us know instinctively that there is a relationship. When we exercise, we sleep better, right? Reduced depression, improvements in function, and weight loss have all been associated with improvements in sleep due to exercise. I'm not sure if I made this clear, but it's best to exercise in the morning or afternoon. And if you're going to do something at night, make it something relaxing, maybe some yoga or some breathing. And again, older adults with sleep problems, exercise has been demonstrated in research studies to improve sleep quality and reduce sleep aid medication. So if you're not getting your exercise, maybe another reason why exercise is so important. So more sleep hygiene, more tools to enhance sleep. Avoid caffeinated foods and drinks 4 hours before bedtime. Now I'll tell you a funny story. For my birthday, family got me a nice dark chocolate cake. I don't usually eat cake, but I was indulging. It was my birthday. It tasted really good. I also had a little coffee later today. And let me tell you, it was a bad combination. I did not sleep at all that night. Sometimes you have to learn from mistakes, right? Avoid alcohol or smoking 3 to 4 hours before bedtime. Now we think of alcohol as something that helps us sleep if we're having some anxiety. And again, a drink or two has been shown to be beneficial for health. However, what happens when we drink a lot is that our sleep gets interrupted and we don't have good sleep, good quality sleep. So again, something to consider. Don't take unprescribed or over-the-counter sleep pills. Again, talk to your medical professional. And finally, avoid daytime napping, especially if you have difficulty sleeping. What a nap does is it reduces our sleep drive at night. So, if you sleep well and you want to take a short nap during the day, I think that's fine. And again, I don't want to scare anybody and say you shouldn't nap at all. But again, to understand how to promote sleep health, understanding sleep drive, I thought was pretty helpful for me. Now the last part of sleep hygiene and sleep tools. Comfortable, relaxing sleep environment. And that, again, let's talk about it. What is that to you? It may mean something different to different people. Avoid too much light and noises. One study that I actually saw on TV talked about college football players. And what they did was, first of all, they wore these orange sunglasses which blocked out blue light from cell phones. You know how the college kids are on cell phones so much, so that was really important. The other thing they do is they wear sleep masks. It keeps it completely black. And what they found is they found reduced injury rates. They found improved speed, in these athletes. So they believe that sleep is a weapon to enhance performance. So, that was pretty interesting. So again, going into avoiding light-emitting electronics, computers, cell phones, iPads, keep them away from our bed. Yes, there's emergencies, but many times it's a text from a friend, or it's surfing the internet, things that we don't really need to be doing when we sleep. But that's something for you to think about. Just know the effect of the blue light. And there's actually on your phone, you can take away that blue light setting, which I actually learned a couple weeks ago, so maybe that helps you as well. Avoiding large, spicy meals and excessive liquid 2 to 3 hours before bed, and sometimes even 4 hours before bed, depending on your situation. And finally, talk to your healthcare professional if you're having trouble. Don't live with it. Talk to people to see if there's some things, and hopefully I give you a couple things you can take home right away. You can try and see if that helps. And if you're still having trouble, talk to somebody about it, because we see how important, how vital sleep is to our overall health. So, I want everybody to take a deep breath. Doesn't that just make you feel better right away? So what stress reduction techniques do is they quiet our mind. When we don't get sleep, we have that cortisol going on in our body. And that is the fight or flight mechanism that is involved in insomnia. So just trying to calm down our nervous system, which tends to be revved up these days with breathing techniques, stress reduction techniques are recommended. So some of these techniques include progressive muscle relaxation, which I won't get into today, maybe a next lecture where we talk about stress and resiliency. Progressive muscle relaxation is when we tense muscles and then we relax them. And that's one really good technique to use. Breathing exercises are really helpful. And all of these should be on that handout if you didn't get it at the end of the lecture in the back of the room, which talks about good sleep hygiene. Diaphragmatic breathing, where we breathe from our diaphragm, not from our upper chest, is known to help relax us. Pursed lip breathing, which they teach for patients that have cardiopulmonary issues in the hospital, where we breathe in through our nose and out through pursed lips. It's been shown to relax us. And one thing I thought we could try today is the 4-7-8 exercise, which includes which they say to do 4 times and up to twice a day. And again, this might be difficult for some of you, but you'll get the understanding that this can really relax us. And they say if you're going to do something at night before you go to bed, you really should practice it during the day. So that's why I talk about it a couple of times. So what I'd like you to do, and I'll demonstrate first, is just breathe out. And then we're going to breathe in for a count of 4. You don't have to do it right now, but I'm just going to explain first. So breathe in, 1, 2, 3, 4. Then we're going to hold the breath for 7 seconds, or 4 or 5, whatever you're comfortable with. And then we're going to breathe out for 8, but we're going to forcibly breathe out. So in for 4, hold for 7, breathe out forcibly for 8. Now we're going to do this 4 times, okay? And again, if you feel any symptoms, if you feel lightheaded or anything, don't do it, just stop. But take your time, try to relax, and let's give it a try, okay? So here we go. So the last stress reduction technique is just meditation. And I am a novice meditator. Somebody recommended that I try an app called Headspace, and who here has used that Headspace app? Okay, so I recommend you try it. Basically, it's a guided meditation that's on our cell phones. And you can also go to YouTube. They have meditation you can find there as well. But again, these are all techniques that we can try to do to help us relax, to help us sleep better. So, in summary, my hope was to raise awareness of sleep as a healthy behavior. What was one thing that you learned today? We'll go into this in just a second. Is there one small change that you can make to your sleep habits? And if there is, maybe write it down, because it's always better to do that. And talk to your loved ones, your family and friends, and medical professionals if sleep is an issue for you. Sleep is not an inactive period where we're not productive, but it's an active period of recovery where the body heals itself. Can I get an amen? And just like exercise and nutrition, sleep is vital to optimal health. So I like this quote: sleep is the golden chain that ties health and our bodies together. Thank you so much for coming today. And I hope you join me for November 19th when we're talking about the endure elements, which is our resiliency, and how we improve that as well. So it's a really interesting one. Talk about stress reduction techniques a little bit more. But I really hope you took home a couple things today. And again, I just want to thank you all for coming out on a miserable day for weather and for listening to me spread this message of health promotion and prevention. It's really important to me, and I hope you